Medical Officer at DWIHN Integrated Health Network. I'm a board-certified pediatric and adult psychiatrist. I'm also certified in community and public psychiatry. Welcome to another edition of Askthedoc Digital. If you aren't familiar, Askthedoc is a bi-weekly newsletter where I share helpful information about COVID-19 and mental health topics. Readers can submit questions at askthedoc@DWIHN.org and I answer them. You can find them on our website under COVID updates. All right, so let's just get started with our question. Suicide rates have gone up during pandemic. What do you think might be the cause of this? And then we have a second part to the question that says, are there noticeable warning signs that one should be looking for in ourselves or the loved ones? All right, very good question. There are a significant number of studies that have indicated that symptoms of depression, anxiety, and adverse mental health conditions have gone up during the pandemic. So younger adults, racial and ethnic minorities, essential workers, and adult unpaid caregivers reported having experienced disproportionately worse mental health outcomes. Increased substance use and elevated suicidal ideations. There were also reports of increase in emergency department visits among adolescents and young children for suicide-related concerns. Now, what the interesting part is that the rate of suicide declined during pandemic. When I say suicide, completed suicide. So when pandemic hit in 2020, there was a record increase in homicide rates, and there was also a large number of drug overdose deaths in the country. And the assumption was that the number and the rate of suicide is going to follow that pattern, particularly after the fact that we have seen this increase in suicide starting from 2004 up until 2018 to 2019. There has been a steady increase that marked it as a public health crisis. But what they found was that there was a minor decrease in suicide between 2018 and 2019. And that decline actually persisted during the pandemic years. And actually the recent study that was mentioned at CDC indicated that there was a 3% decline in suicide during pandemic. Now coming to the second part of the question about the warning signs. So warning signs of suicide are indicator that a person may be in acute risk to themselves and really need an urgent help. Things that you can watch for or are risk factors are talking about wanting to die, expressing guilt or shame, talking about being a burden to others, feeling empty, hopeless, trapped, or having no reasons to live, feeling extremely sad, more anxious, agitated, or expressing an unbearable emotional or physical pain. You can also notice some change in behaviors, such as making a plan or researching ways to die, withdrawing from friends, saying goodbye, giving away your prized possessions, making a will all of a sudden, sometimes taking dangerous risk, for example, even driving extremely fast, displaying extreme mood swings, eating or sleeping less or more, using drugs or alcohol more frequently. So if these warning signs apply to you or your loved one, get help as soon as possible, particularly if this behavior is new or has increased in intensity lately. You can reach out to National Suicide Prevention Lifeline at 1-800-273-TALK, or you can even text hello to 741-741. All right, if you have any more mental health or COVID-related questions, please send it to askthedoc@DWIHN.org. And thank you for tuning in to the Ask the Doc Digital. I'll see you soon. Thank you.